For our project, we did 2 exercises regarding the hip. The first one is hip abduction in sideline, which is an open chain exercise, and the next is bridging, which is a closed chain exercise. Some indications for hip abduction in sideline would be to strengthen the hip abductors for pelvic stabilization, muscle imbalance, ITB syndrome, and hip or knee pain.
The patient position and procedure for this exercise is to start with the patient side lying and have the bottom leg flexed for stability. Have the patient lift the top leg into abduction, keeping the hip neutral or into rotation and in slight extension. Do not allow the hip to flex or the trunk to roll backwards. If the patient is having difficulty with this, you can place the patient up against the wall. You can add ankle weights to provide resistance as the patient's strength improves.
A contraindication would be not to use this with a patient who has had a trochanteric osteotomy. A precaution would be if a patient has ITB syndrome, just make sure to stretch the tensor fasciae lata first if tight in order to strengthen the glutes, and just be careful with patients with trochanteric bursitis. Our second exercise is a bridge and supine, which again is a closed chain activity. Some indications would be for core stabilization, strengthening of the legs, back, trunk, hip extensors, and pelvis. This can also be used as a functional exercise for teaching a bedpan use in an acute care setting.
For the patient position and procedure, begin with the patient in a hook-lying position. Have the patient press the upper back and feet into the mat, elevate the pelvis, and extend the hips. This strengthens the hip extensors in coordination with the trunk stabilizers. If you want to progress this exercise, you can apply resistance against the anterior pelvis manually or by strapping a weighted belt around the pelvis. Have the patient hold the bridge position and alternate extending the knees. To challenge proprioception and balance, perform a bridging exercise using a large gym ball positioned either under the back with the feet on the floor or under the feet while lying on the floor.
A contraindication to this exercise would be if the patient had had a recent anterior hip dislocation or total hip replacement. A precaution would be, just like any other exercise, not to Valsalva and avoid pelvic twisting and excessive back extension.